I would like to introduce our next speakers, Mrs. Patricia Machawira and Mr. Donald Tererai, who bring forth the wealth of experience from East and Southern Africa. They will both enlighten us on the strategic development and deployment of digital tools to bridge the gap in comprehensive sexuality education for adolescents and young people in the region. They will both elaborate on the intricacies of implementing comprehensive teacher training programs alongside the direct dissemination of knowledge to students. And through a combination of low and high technical digital solutions, they have effectively addressed the diverse needs of learners, ensuring access to age-appropriate and high-quality CSE materials. So over to you, Patricia and Donald.
Yes, thank you so much, Don and I will be talking about enhancing health and well-being of adolescents and young people in East and Southern Africa through the work that we are doing with the program, Our Rights, Our Lives, Our Future. So I'll start off with the early slides and then my colleague Don will finish off the presentation. So the work that I'm talking about falls within a large program, Our Rights, Our Lives, Our Future, which focuses on supporting member states to scale up comprehensive sexuality education and school violence prevention in basic education. I think at this point, it's important to note that we have an addition for higher and tertiary education institutions, which is called Our Rights, Our Lives, Our Future Plus. So this does more or less the same work, but in universities, technical and vocational training colleges, and also polytechnics. So the O3 program has a vision of ensuring that children, adolescents, and young people in sub-Saharan Africa are healthy, educated, and empowered to thrive. I think we had, a good presentation and justification of the intricate link between health and education and why it's important to support this work around school health. The O3 program aims to reduce new HIV infections, early and unintended pregnancy, gender-based violence, and child marriage, and also to increase school completion rates. For us in East and Southern Africa region, you may be aware that we are the region which suffered quite extensively from high HIV infection rates. We still do, and our adolescent girls and young women in the region are still very much affected, and early and unintended pregnancy also results in young people not being able to continue with their education. So the program, Our Rights, Our Lives, Our Future for basic education is running in 35 countries across East and Southern Africa and West and Central Africa. We anticipate to have reached about almost 40 million learners by the end of 2027, which is the 4-year period of implementation, over 200,000 schools, and over 500,000 teachers in both pre-service and in-service, and 50 million stakeholders. These are your community members, family members, guardians, religious, traditional, and community leaders. So the map on the left just shows you the countries that are involved. It's being supported through the O3 program. So the O3 program was conceived as mainly a school-based program, capitalizing on the fairly high enrollment rates that school enrollment rates that we have in East and Southern Africa, but also building on a legacy of HIV prevention curricula, which started as far back as the early 90s. So it is the space in the curriculum that has evolved from focusing on HIV prevention mainly to broadening to include comprehensive sexuality education, school violence prevention, and other sexual and reproductive health issues within the curriculum. So the O3 program has those 5 objectives. The first one focusing on supporting and enabling policy and institutional environment. Sorry, Don. And then, so for this presentation, we'll focus mainly on the 2 objectives. The first one being to support countries to scale up and strengthen the delivery of accurate, rights-based, gender transformative, and good quality teaching and learning on CSE and school violence prevention. So this objective speaks to the work that we do do on training teachers around good quality CSE and school violence prevention. And objective 3 speaks to the work that we do, reaching young people directly with information to enable them to respect their right to make decisions and drive change in their lives. And then the 4th objective speaks to the promotion and creation of safer, inclusive school environments. And the last one is, evidence generated from monitoring, evaluation, and research and learning. So for the purposes of this presentation, we'll focus on how we've used digital tools, particularly in those 2 objectives that we're showing there. So, as I mentioned, I think our work has been mainly school-based, but since as far back as 2015, 2016, we've always had local concerns around, and sensitivities around delivering comprehensive sexuality education. So there were concerns from local traditional and religious leader groups on the content, what is the content that you're providing as part of comprehensive sexuality education? And is it appropriate for the younger learners? So there have been local concerns, but from as far back as 2016, we started seeing a pattern and an escalation of this controversy, and realized that this was now coming from international forces, particularly conservative right-wing groups from the US, with Family Watch International in particular leading a coordinated opposition against comprehensive sexuality education. So these are, the tactics that we saw in the patterns of opposition. So disinformation, using multimedia platforms, and targeting key leaders in ministries of education, and the timing of the opposition usually intensified during a time of key milestones. So for example, around the time where we're launching the ESA ministerial commitment or the WCA commitment. So what is the significance of this? It is that in a number of countries, we were not able to advance with provision of comprehensive sexuality education through the school system because the opposition was able to penetrate the WhatsApp groups, for example, of senior policymakers in countries like Ethiopia, and there was a pushback from government on the delivery of comprehensive sexuality education, and also in countries like Kenya. So this intensified. And then we also saw the coming of COVID, which made us look at, so how in those countries which had been affected by opposition, how are we now able to reach young people who we otherwise can't reach through the school system? You can move to the next slide, Don. Next slide, please. So, sorry, can you confirm me? Okay, thank you. My slides were not moving. So in this presentation, we will talk about how we've been able to reach young people, adolescents and young people via trained and resourced teachers in the first section, and then Dawn will pick up and speak to the efforts that we've used in the O3 program to reach young people directly. So one of the ways that we've used to reach young people through training of teachers is through the development of the CSE online course. So for the O3 program, teacher training was a huge resource. So what we did in developing the CSE online course was we wanted to be able to reach large numbers of teachers, but also at a reduced cost, because reaching the complete teacher training course on CSE would require that you bring teachers to one location for 5 days, and it was usually quite expensive. And that became a huge expense, especially given the size of the O3 program. So we developed this online CSE course for teachers, and the content of the course, I think you can see there on the right, the learning units that are covered by the course. So participants have access to this material, which covers 10 learning units on CSE content, as well as classroom management and CSE delivery best practices. So since 2015, you can move to the next slide. Since 2015, when the course was developed, we've been able to train 10,485 teachers across 18 countries. And the course is currently available in English and Portuguese. It's a self-guided course. It can be accessed on any device, and teachers study at their own pace anytime. It has tests, to test your learning, and also quizzes, and also some learning activities, valuable discussions and feedback, and teachers are able to earn a certificate after completing the course. So the teachers who have been trained are automatically integrated into a community of practice to allow them to remain connected. And this community of practice is also a platform to allow teachers to share knowledge and experiences. Because what we realized is, after going through this online course, or even any teacher training, that's not enough for a teacher. You need to be constantly connected so that you have a forum where you can ask questions, where you can find out how other teachers are dealing, for example, with sensitive topics. So we have the Connect and Learn community of practice, not only for those who have been trained using the online course, but even those that we are training using the face-to-face methods, either in pre-service and also for in-service. So this Connect and Learn is a community of practice, which is connecting teachers and other stakeholders in a platform where they can share knowledge and experiences. And then it is complemented by a mentoring and support supervision program, which includes activities such as thematic workshops and webinars for teachers on subjects where teachers require more information. For example, how to deliver CSE to learners with disability. We've had a webinar on that, and a number of other topics, a number of other selected topics. So the teachers, again, who are part of the community of practice, have access to the O3 digital library, where they can access UNESCO created digital CSE resources. And they also get links to global resource libraries, such as the Amaze videos, which they can use as tools to supplement their teaching in class. So one of the plans that we have on the horizon for 2024 is to develop a lesson plan generator, which is artificial intelligence powered. Teachers will input lesson parameters and guidelines in the tool and get recommended lesson plans based on approved UNESCO international technical guidance. I think a lesson that we've learned, and I think Tigran, you mentioned this as well, is that scripted lesson plans are quite popular for teachers because they really provide teachers with that guidance. And where teachers have not been trained or are not feeling comfortable to develop lesson plans, then they can get that support, especially for us, where in a number of countries, CSE is not taught as a standalone subject, but integrated across a number of subject areas, which means that more teachers are needed to be able to support the delivery. So the AI lesson planner for teachers automates the foundations for lesson planning, and through that, teachers have instant access to structured lesson blueprints, which are tailored to specific topics, thereby helping them with the lesson preparation while ensuring that we are comprehensively covering the curriculum and making the teaching approach both efficient and effective. So I'll hand over now to my colleague, Don, to talk about how we've been reaching adolescents and young people directly through digital and low-tech learning experience.
Thank you so much, Patricia, for setting that scene. I'll be looking at how we reach young people directly through digital and low-tech learning experiences. So just to give a background on this, the O3 program recognizes the diverse needs and circumstances of adolescents and young people, including those who are out of school or hard to reach. I think Patricia provided this background very well when she mentioned that in some countries, it's difficult to reach young people that are in school. So to effectively engage these groups, the program really employs a multimodal digital approach to deliver CSE programs. And our approach is guided by what we call the O3 Digital CSE framework. And it integrates three critical elements, the first one being content, the second one being digital tools, and the third one being the engagement strategies that we use. So where these three intersect, we'll find content that is scientifically accurate, is culturally sensitive and age appropriate. And we use various digital platforms and technologies. These include mobile applications, chatbots, radio, television, social media, and so on to disseminate the content. Then the final part is the pedagogy. So we employ engaging pedagogy approaches, interactive strategies, and learning activities to foster knowledge acquisition, skills development, all aiming for positive behavior change that can lead to positive health outcomes for young people. Now, in implementing these digital solution, our guiding principle really is to use the technologies that the young people already have access to and know how to use. So we prioritize the most widely used devices and platforms so that we ensure that no young person is left behind, regardless of their digital access or circumstances. So what we have done is we've identified 3 levels of digital access in East and Southern Africa. These are namely high tech, tech, which you can call medium tech if you want, and then low tech. So we still find in Eastern Southern Africa that there's a very big digital divide between those who have the technologies and those who don't have the technologies. So we deliberately plan for all young people. So in low tech, we've got young people who lack access to digital devices and digital connectivity. They may have basic feature phones, not smartphones. They do not have 3G or broadband. You could find they've got maybe GSM technology allowing for SMS. And for these young people, usually would use tools like radio, through radio lessons, through radio drama series, and television as well. You see there are also some innovations that are in red that we are still working on and will be bringing out soon. And in medium tech, we find young people who have got limited mobile phone or computer access, and have got limited 3G or 4G, which is sometimes poor or unstable or unreliable. And still across the continent, broadband is still very, very expensive. Then we also find that these young people may not always have a device, as they may be sharing it with others. We found out when we were launching WhatsApp chatbots that many young people were actually using the smartphones from their parents and from their guardians. So for this medium tech, we've got innovations such as WhatsApp chatbots, mobile applications, and social media. Then we've got the high tech. The high tech, these are young people who have good access to a range of digital devices with good quality and fast connectivity at all times. This is very, very rare in the region, but we find the young people who have got access like to use responsive resource websites, which give them CSE content. We also have podcasts, and we will be launching some micro-learning courses soon through some mobile applications. And one of the areas that we are also conceptualizing on is on online safety, with the realization, of course, that being on the internet, the young people would need to be safe. So I'm going to expand on one example from each of these 3 categories, starting by how we've been using WhatsApp to support learning. So through the O3 project, we developed the Zizo Paden and Kupunzira Paden. This basically means learn from home or learn remotely. These are automated chatbots that operate on WhatsApp. And WhatsApp is one of the most commonly used applications in East and Southern Africa. It's a low data messaging platform with an intuitive interface. I think almost everyone has used WhatsApp by this point, and it makes it a very ideal tool for reaching young people. So to leverage on this popular platform, we developed the chatbots on WhatsApp. and they provide CSE resources to students across Zimbabwe and Malawi. While the primary focus for these chatbots is on guidance and counseling curriculum in Zimbabwe, for example, and life skills education curriculum in Malawi, they also offer resources on other non-CSE related learning areas. We found that this can be a strategy that offers more value to the students and also brings more students onto the platforms. So currently we've got 180,000 students in Zimbabwe and Malawi actively using these chatbots. And on low-tech, one of the good examples that we have is the use of radio and TV, which are the most common, especially radio is very common in rural Africa. And we've used radio in different ways. Firstly, through radio lessons. So UNESCO has partnered with ministries of education in various countries, including, for example, in Malawi and in Zimbabwe, to provide CSE lessons via radio. So the drivers for this initiative really was the need to reach all students while ensuring continuity during the COVID period. And another type of radio experience is the broadcasting of drama series. An example of a drama series is the Let's Talk drama series. So this is a 13-part radio drama series, which is in English, French, Portuguese, and Swahili, and it's aiming to reduce early and unintended pregnancies among adolescents and young people. The way that we rolled this out was by training 300 journalists in 12 countries on CSE and also on the content of the radio drama so that they can air the drama and host discussions on their radio stations. And this drama series has been aired in Malawi, in Kenya, in Tanzania, in Zimbabwe, and other countries, reaching over 40 million listeners in Eastern Southern Africa. Then one of, I would call it one of the high-tech innovations that we have is mobile applications for young people. So we've developed some mobile apps in Kenya, in Namibia, in Zambia, in Zimbabwe, and in Uganda, which provide students in universities with information on sexual and reproductive health, the location and contacts of nearby services, and free access to professional counseling. So it's one of the high-tech innovations in the sense that to access some of these services, you need to be online. For example, we've got student counselors that are available to provide counseling to the students via the mobile application. There is a panic button as well that students can use when they are in situations of distress and want to alert other students. And of course, location-based help services, which would use the mapping functions on the phone to help students locate SRHR services that are close to them. And some of the offline features of the mobile app include sexual and reproductive health articles, which students can read when they do not have the internet. So these are three examples of digital and low technology and low tech that we are using to reach young people directly. But I would like to invite you to scan the QR code on the screen. It will lead you to a handbook, which is a list of all the digital platforms and tools that we are using in the O3 program. Thank you so much, and this is the end of my presentation.